शब्दों के माध्यम से आपको आमंत्रित करता हूं कि अलग बात कि खामोश खड़े रहते हैं मगर बड़े लोग हमेशा बड़े रहते हैं। एक बार जोरदार तालियों के साथ आमंत्रित कीजिए हमारे वैद्य गोपी कृष्ण सर को। सर प्लीज जॉइन अस।
So before we start with this particular session, wherein I'm asked to discuss about my experiences in treating cancer patients, I would like to acknowledge the whole team of Ayurved Anantam for inviting me for this particular occasion and giving me the stage to express few of my opinions in front of this elite crowd. Before we start with this particular session, I'll be speaking very specifically on the Rasaushadhis. It's not like I don't use a herbal drug. Definitely I do use it, but more of Rasaushadhis. In the set duration of time, I would like to run with the slides. And once we need to discuss much of the things off the stage, we can discuss them in detail later on. The Ugra Rupa of the gods is the reason for the Vyadhi. Salutations to the god, because the science of Ayurveda, specifically Rasashastra, is also been origined from the divine mythology. So it is the only answer wherein we can combat with this particular disorders. Might be every aspect of Rasashastra is a sort of Daiva Vyapashraya Chikitsa as well. So on this grounds, with the salutations to the Ugra Rupa, let us see how much of Shanta Swabhava can we make the patient from the Ugra Vyadhis, like that of malignancies. The very first part of the treatment, don't promise your patient. Normally what happens, it is quite encouraging. People start on the day one, yes, I'll treat your cancer for 100%. Because sometimes even though the patient is in a stage 1 or stage 4, sometimes it is so notorious because of the Bahudoshavastha and the root map, how it takes with, makes it more and more complicated. I do have the follow-up of my patients who are on my treatment and absolutely fine with Rasa medicines from past 25 years, who were on positive with cancers with huge metastasis. They're fine even today. Even this morning I had a patient here who was positive from past 18 years and she's fine today. Only thing is we ask him to go for an explorative scan yearly once. Might be a simple CT scan, or occasionally once in 3 years he can go for a PET scan just to see. And the tumor markers, of course, they are very much needed. And what Ayurveda speaks about it, I'll just run through the slides because people want some references from the textbook. The prime focus here from the textbook is about try to focus on Vata. I don't say Pitta and Kapha is not important, absolutely important, specifically Vata and Kapha, and out of that, Vata is a chief factor where you need to manage things. And Rasa medicine is one such thing which can manage Vata wonderfully. Especially the drugs like Tamra and Gauri Pashana is an excellent combination. So my choices are most of the times with that of the Pottali Kalpanas. So if I say this Tamra Garbha Pottali, if it's not available to you, you can definitely take it as Tamra Basma. So it depends on what is your choice, but my choice is always the Pottali Kalpana because more and more samskara will be more benefit to the patient. So this is what the references from the textbook speaks about. So I'll just run through all of them because you know what is the Chikitsa Sutra of it. The one which is being highlighted is very specifically as the Vata Hara Chikitsa. Even though it is Pittaja or Kafaja Gulma, Acharya has focused a lot on Vata. So always I try to say, in every patient of malignancy, try to use Tamra Gauri Pashana, which is a drug of choice to control these factors. If you have the drug called as Vishagarbha Pottali, which is a combination of all the Vishavarga Dravyas, Hartala, Manashila, Gauri Pashana, it's a great choice. You don't have it, the alternate of it is Samira Pannagarasa, which is a Kupi Pakwa preparation, and it's easily available to us in many of the pharmaceutical companies. And also it is very easy to prepare. If you can prepare it by yourself and use it, it's a great choice. Samira is a synonym of Vata. Pannaga is a hook or a ankusha. Rasa is a mercurial preparation. So Samira Pannaga Rasa is a mercurial preparation which is meant to hook or control Vata. That's the reason why we need to use Samira Pannaga Rasa in most of the conditions where you find Vata is a chief factor. Vyadhi Pratyanikam, Anuloman and Pachanam. This is the reason why most of the patients we use Arogyavardhini. Very simple drug, easily available to all of us. We try to use Arogyavardhini for this particular reason because of the Chikitsa Sutra. These are few of the Mukhya as per various acharyas. Vataja Gulma, Pittaja and Kaphaja. And most important factor is whenever you're having Raktaja involvement, which is very commonly seen. Rasa and Raktaja conditions. In all these conditions, try to use Pravala at an outset. Pravala is very much needed. I have given across even the Dhatugata malignancies and what is the Chikitsa Sutra and how is it we can manage. But very specifically, when it is Rasa and Raktaja involvement, Pravala is said to be excellent drug of choice, along with Tamra or along with Gauri Pashana. Panchakarma Upacharas, I don't strongly recommend to go for Tivra Rechanas or Tivra Panchakarma Chikitsas. Mrudurupa and multiple times is a better choice instead of going for a Tivra Rupa of Panchakarma Chikitsas. Patya Patya, Rogochitam, as per the patient condition, because by the time the patient approaches us, he is in Vektan Bedavastha. By the time the patient is to us, he is in complicatory stage, and one of the very common feature which we see in most of the malignant cases is absolutely no Agni. Jatra Agni is nil. The patient is totally having anorexia. The patient is absolutely not taking food. So whatever the amount of food the patient takes, give it to the best possible way. The soups are the best form. And what we usually do is, for every soup we add a small pinch, which is approximately around 1/4 rati of Tamra Basma to the soup, and it's given to the patient. Might be he takes it for 3 times a day or 2 times a day. We add 1/4 rati of Tamra Basma or Tamra Garbha Pottali into the soups, and it is being given for oral administration. This is specific to speak about why Vata is involved here and why we need Rasa medicines for controlling Vata. This is a reference from Rasaratna Samuchaya and Ashtanga Sangraha. This is the forms of Rasa which can be used. Normally I'll say when I ask with various preparations to go with, nowadays the generation is something like they want everything in ready platters. I'm not happy to convert or prepare something, a partial portion of the medicine and give it to my patient. I'm very convenient, it's available in the market, I procure it and I give it to the patient. It should be fine. So on these grounds, you can choose the specific drug because we have lots of pharmaceutical companies come with various Rasa preparations nowadays. This is Thailam, which is also called as a Kupilu Thailam from the reference of Agastya Samhita, which is very specifically used for the pain management in cancer patients, which is also used for the external application on the affected areas where you have the swellings in the body, abdominal swelling, whatever it is, lukewarm way. And the method of preparation is like this, through the Varti. It's not with the Thaila Paka Vidhi, which we regularly do for all the Thaila preparations. So this is an excellent choice because most of the patient, more than that of cancer, he is very much worried about pain. He's having severe pain. Might be it's lung cancer, patient is worried about some chest pain. He's having a cancer in the bone, it's very drastic pain to control it. For all those patients, application of this Thailam is one of the excellent choice to control it. Sarveshwara Parpati, this reference is from Rasaratna Samuchaya Antavidrudi Adhikara. When you have the multiple metastasis from the various tissues of the body, this is an excellent choice of medicine which can be given to control it. Lohagarbha Pottali, the one in the Lingakara, because these are all the pics from the Rasa Pujana time. So during the puja, the Lohagarbha Pottali is specifically given in the disorders or the malignancies related to the Raktava Shrotas. I will say every disease spread happens through the Raktavashrotas, the metastasis. So for every patient, Loha Garbha should be an essential component to a small concentration. Usually I give 4 grams per month, which is a very small portion of Loha. This is Mallagarbha, specifically given in Vata and Kapha cancers. With origin of Vata and Kapha, we give this. This is excellent choice of drug even in lung carcinoma. Mallagarbha, Shilagarbha, Talagarbha. These 3 are Taratama Bhavas depending on the severity. And on that grounds, we try to give these 3 combinations in the patients based on their Prakruti and give it in Vata and Kapha origin cancers and specifically to be given in the conditions wherein the patient is suffering from lung carcinoma or respiratory system disorder. This is a textual reference, indications. Tamragarbha, chronic disorders. The patient is having malignancy since many years. He is being treated with some of the other treatments. And for those patients wherein to manage the conditions in a better way, we try to go with the Tamragarbha, where you have some sclerotic changes. Say, for example, the patient with lung carcinoma is having a sclerotic change in the lung fibers or fibrotic changes in the liver, in liver cancers. Or there are many conditions like osteophyte formation or devastation of the bones in bone cancer. In all these conditions where you have the sclerotic changes or alterations in the texture of the tissue, in those cancers, Tamragarbha is a better choice, where you have hardening of the tissue, where you have the tissue is altered its parenchymal nature, where it has become more stubborn. In all those conditions, Tamragarbha is a better choice. The textual reference of it, this we also use in using with anorectal carcinomas. For the Kshara Sutra, just like you apply the Snuhi, Kshira and all, we apply Tamragarbha Pottali with the Kshara Sutra, and that has been given for fistula in ano or arshas like clinical presentations in anorectal carcinomas. This is Rajatagarbha, specifically given in female cancers, breast carcinoma or uterine cancers, or where you have severe debilitation of the patient. In those conditions, Rajatagarbha. Vishagarbha, when the disease is very active or it's in a state of metastasis. In those conditions, we go with Vishagarbha. Tridhatugarbha, specifically I find a good response in teratological, cancers in the childhood or pediatric or neonates. And also it is used excellent in case of bone cancers. Shilagarbha, similar to that of Malla and Tala. Pravalagarbha, when the patient is on chemotherapy or radiation or Pittaja Pradhana cancers, usually seen in some blood oozing conditions, especially in squamous cell carcinoma, when it is affecting the blood vessels, you find the oozing of the blood from the ulcers. In those areas, we use this Pravalagarbha. Ratnagarbha, I am unable to understand what's happening to the patient. Whatever the medicines I know, I'm trying to give it to the patient, but still the patient is not responding. Then the text asks us to prescribe the Ratnagarbha Pottali to the patient. So this has been given to the patients almost in the terminal illness, when the patient is totally out of control, not responding to any treatments. Hemagarbha, possibly most essential component I give in every patient. Almost every patient I prescribe this. This is an excellent choice of drug. It is indicated in syndrome-like presentations where you have the multiple tissue involvement, Bahudosha Avastha, Sannipata states, where the patient is having severe debility, which is very commonly seen in all cancer patients nowadays. All these patients, we try to go with the Hemagarbha. What are the forms, routes of drug administration, which we give in the cancers? Kavala and Gandusha. We give Tamragarbha, Mallagarbha in the form of Kavala and Gandusha along with other Tailas and Kashayas to the patient. I have case reports of this which I'll be presenting in the eventual slides. We give Pottalis in the form of Lepa, especially when you have this ductal carcinoma or squamous cell carcinoma where you have the ulcerations. In those patients, we try to apply these Pottali Kalpanas on the ulcers, where you find a significant improvement in the patients, which is very much useful. Just now in the previous session, Mamta madam was explaining about the application of that Haratala, where you have the Haridradi Lepa on the face. The same way, we used to apply Haratala, arsenic component, which is also used as Roma Shatana. When we see why this Roma Shatana happens, it does a superficial necrosis of the tissue, but it doesn't penetrate deep. That's the reason why Haratala is also used in Roma Shatana yogas. And that is the reason why we apply this on non-healing ulcers of malignancy, where you find the superficial layer of the cellular textures, which is affected with cancer, is being removed off. So many people who have attended my previous sessions would have already seen the patient reports. I have many reports on this for the applications of the Pottali Kalpanas on non-healing ulcers, which is very commonly seen nowadays. As a Basma Basti, this is a coined term which we usually use in our patients. Any of the medicine forms, because most of these patients coming to us are unable or unfitted to take the oral medications to the dosage what it has to be taken. So we give the medicines per rectal route. So there we mix up all these dravyas which we need, like the Hemagarbha Pottali or Trailoka Chintamani, Ratnagarbha, all these things into the Pottali, in the form of Basti Dravya, and give it per rectal route, which is also an excellent choice of treatment to the patient. Similarly, we give it in Vamana, Virechana, and also it is given in the form of a Dhupana Karma, Udvartana, and Muhur Muhu Sevana. The drugs is also being used for application to the laryngoscope, endoscope, or colonoscope. Through the instrument, if you have a support from any of the gastroenterologist or a person who is trained with either of these techniques, you can mix up the basmas and give it through the endoscope to the affected areas. I do have many case reports of either of these conditions. Yukma Pottali Prayoga and Anukta Pottalis. I want to use Jaimangala Rasa in the patient suffering from cancer. My choice is Jaimangala Pottali. I want to use in the patient with Arogyavardhini converted in the form of a Pottali Kalpana. Sutta Shekhara Rasa in the form of Pottali is a great choice for my patient. So for all those conditions, we name it as Anukta, which is not a textual reference. But we have converted them into the Pottali Kalpanas, and that has been given to the patient. Yukma Pottali is a combination of more than one Pottali. Say, for example, I want to give Abragarbha and Tamragarbha to the patient. Mix up both, prepare in one formulation, and it is given. This is called Yukma Pottali. Based on Shrotas, Rasa and Raktava Shrotas, Lohagarbha and Pravalagarbha is a drug of choice. Mamsava Shrotas, Tamragarbha, Vishagarbha and Rajatagarbha. Medova Shrotas, Talagarbha, Shilagarbha and Rajatagarbha. Astiva Shrotas, Pravalagarbha and Tamragarbha. Majjava Shrotas, Mallagarbha and Rajatagarbha. Shukrava Shrotas, Tridhatugarbha. Ojas, Hemagarbha and Ratnagarbha. So these are specific based on our experiences wherein we are giving it to the patients. Based on the Shrotas also, we can plan up the treatment. One such example here I am taking is the Annava Shrotas. The Moola of the Annava Shrotas, as per the textual reference, is Amashaya and Vama Parshva. The textbook asks us to treat the Moola at an outset. So here it is Amashaya. You have a specific drugs mentioned in Rasashastra for Amashaya Balaprada. Bang is one such drug which is excellent choice. Amavikaras, which is also a Chikitsa Sutra as explained in Charaka Vimana. Amavikaras, Deepana, Pachana, Aruchi, Chardihara, Shulahara, Atmana, or few of the conditions which we take in treating the patients related to the malignancies of the GIT. And based on that, we'll try to see what happens to the conditions like gastrointestinal cancers. As you can see here, you have the upper GIT and the lower GIT, and also accessory organs which can be affected with cancer and having its effect on the GIT. This is an example. As you can see here, the oral carcinomas where we give Kavala and Gandusha of the basmas along with some tailas and kashayas based on the patient. If it is adenocarcinoma, the media used is Varunadikwata. If it is squamous cell carcinoma, the media used is Panchavalkala. The media. for mixing the basmas. And this is how the patient responds with the oral basmas for giving kavala and gandusha. As a lepakalpana, you can see the malignancy there with the application of tamragarbha and how it eventually disintegrates and it disappears. So we can have a better benefit, but what is the dosage form? We need to give us the oral dosage. What is the drug particular oral dosage? The same dosage is given because somehow this is going orally only again. We are not going to remove this out. Only the kavala and gandusha, we can ask the patient to throw it out. But here what happens for the applications, the patient will gulp it. You can see this, how the patient is respond with kavala and gandusha with all our cancer patients. This is rodent ulcer, one of the most toughest cancer for any person because they never respond to the medicines. And here, even in this, you can see the local applications. And of course, oral medication is also being given. The patient is quite happy because everything got healed off. And she's smiling. I cannot reveal the face identity of the patient, but she is happy that she's out of it. This is adenocarcinoma, the same way how it is being treated with kavala and gandusha. This is to the laryngoscope. We can apply the tamragarbha on the pyriform fossa, the cancer of the pyriform fossa, how it sloughs off. This is a case of CA thyroid which is compressing on the esophagus and making it more difficult for treatment. Tamragarbha is a drug of choice here along with hemagarbha. You can see the neck report, scan report of this particular patient. Eventual slides. She was a known case of CA cervix along with that metastasis on the lymph nodes at various parts of the body and over the thyroid as well. And later on, FNAC, the upper paragraph on the left-hand side, you can see the last line, no evidence of any malignancy seen in the smear evaluated. The total lesion has been disappeared. This patient is under the treatment almost from 18 years. People are worried, giving rasa medicines, patient will lose their kidney. So it's not for my satisfaction, for the people's satisfaction, let the creatinine come out. Creatinine is still normal. The patient is on medicines with rasa medicines from 18 years. The patient is fine. This are the reports quite long back, 2017. Now it is 2025. This patient is still survived even today. Esophageal carcinoma, this is the textual indications of it. I'll run through them. This is a scan report, PET scan report of the patient with multiple metastases, with caseating lesions and huge spread throughout the lungs. The report of the same patient after 6 months of medication. All the lesions have disappeared. Specifically, if it is lung carcinoma, Mallagarbha to be given along with any other drug of choice, whichever you prefer. For me, as I said, it is Hemagarbha, is an essential component, small portions of Lohagarbha, and here, because it is lungs involved, Mallagarbha is a drug of choice. This is just to zoom out. CA esophagus, blocks, and this is before and after treatment. Hardly 1.5 months. The whole of the esophagus which has been blocked here, you can see the date there, 26/6/2019. Giving this, and there the patient is 17/8/2019. Within that, the whole block in the esophagus is disappeared in the endoscopy report, before and after treatment. And this is a report in the center, which has been zoomed out to see how the lesion have disappeared, along with the time taken for disappearing it. One thing is you can do it through endoscope, apply on the affected area, and if possible, the probe, you can touch it on the lesion, it starts to ooze, because normally cancer starts to bleed if you touch. And once it starts to bleed, you pour the medicine there. Because maximum medicine is being absorbed, and patient has a very good response. And in case if you're unable to use endoscopy for applications, what should I do? Because it's not reachable to every person. So on that time, what we do is we give it in the form of muhur. What is that muhur? We do small amount of the combination of the basmas, what you're taking, is taken, and the patient takes it on sublingual basis with a very small concentrations. Say, for example, I go for even 2 to 4 grams of Vasma per day, happily. I have some patients wherein I go to 8 grams per day when needed on hourly basis. Nothing happens for 1 or 2 days or even 1 week. Eventually, we start to reduce the medicine. This is the importance of what Acharya wants to explain us in the form of Vardhamana Prayoga of the Parpati Kalpana. Frankly to speak, it is not having Ati Agni Sevana in Parpati Kalpana. It is Mrudu Agni where we are using it. Still the metals are in metallic form, but still he is asked us to indicate it on Vardhamana Prayoga. The same concept is being used here for administering on the increased dosage of the medicine to the patient. Nothing will happen, don't worry, provided you prepare a proper medicine and give it to the patient. If the medicine is wrong, even giving half to 1 ratta is also toxic. This is a case of stomach carcinoma, as seen there. And Ayurveda speaks about Amashaya Balaprada, Bhang is being indicated. Amashaya Mamsar Budahara, Ahifena is being indicated. One more thing is Kavaigunya, which is very common in many of the cancers, where you have the blockages of the Shrotas. And for all the Kavaigunya or Sangha pathologies, where you, because of the Sangha, the tissues start to move on the Vimarga Gamana, because its channels are blocked. As you can see in esophageal cancer in the previous slide. In all those conditions, few of the drugs which has been indicated in the Rasa textbook is Vatsanaba, Kupilu, and Gauri Pashana. These are the drugs which has been used for Sangha pathologies. Might be you take it on deep vein thrombosis, atherosclerosis, or any of the Shroto Avarodhas. But here, because it's a context of cancer, I am asking you for any Shrotas which has been blocked. For all those conditions, we have to treat them with Gauri Pashana or Vatsanava Yogas. Gulmanashana, where you have huge growths. This is a case report of this patient. So we have treated them in 2019, and even this patient is survived even today with CA stomach. These are the eventual PET scan report of the patient. This is CA stomach. This is also used in folklore practice. The eggs of this red ants, which is very commonly seen in our Western Ghats, the juice of it is being used for treating cancers by the folklore people, which is also very effective. This is how through the endoscope we apply the medicine. Here it is Panchavalkala Kvata as a medium. This is also a case report of a patient before and after treatment. Basically, this patient is a pathologist. She's taken it only for 45 days. See the scan report before and after treatment. All the lesions in the stomach called as a necrotizing carcinoma have disappeared here. Haratala preparations are very good to arrest metastasis as well. Oja Prada, you have to give life to the particular area. There are 3 drugs explained in Rasashastra to arrest this particular pathology, where you have stop of blood flow, or where the blood is not passing through a particular tissue, or where you have to energize the ojas in the patient. One thing is Haratala, one is Swarna, and the third thing is Panna. These 3 drugs can be given in all these conditions where the patient can have the rejuvenation of the tissues. This is again the PET scan report of a patient. Here you can see the CA 19.9, which is a tumor marker in the patient, and the size of the lesions which disappear on the eventual PET scan reports. And the tumor marker here, it was more than 200, but by the time we started to document, it was 130, eventually turned to 58.4, 11.28, 18.69, 14.92, and even this patient is also survived till date with normal tumor markers. And even the scan report says the things are fine. Creatinine, people are worried about kidneys. So even the kidney function is normal here. Nothing to worry as such. Hepatitis B causing hepatocellular carcinoma. Here, if it is hepatic cancers, very specifically, Tamra yogas are very helpful. So normally, along with Hemagarbha Pottali, here we give the Tamra Garbha Pottali to the patient if it is liver cancers. These are the reports of the patient with Tamragarbha and Hemagarbha as a combination with hepatocellular carcinoma before and after treatment. This is also another case wherein the patient has the cirrhosis set in and the patient is in end phase as hepatic coma. And this is before and after treatment of the patient. You can see the liver is come to normal parenchyma, and here the patient is absolutely normal, is out of hepatic coma because of the cirrhosis which has been set in. This is what Hemagarbha and Tamragarbha can do to the liver and make the patient to survive even after which such conditions. Gallbladder CA, colorectal carcinomas. If it is colorectal, most of the times, I not say always, it is adenocarcinomas. So in all these adenocarcinomas, where absolutely they don't listen to you, they are very adamant, and they are fast spreading. And if at all the patient is already undergone with surgery, then the condition is still worst. Because the patient would have been, once it is no touch method, then it is great. By the time the patient is taken all surgical interventions and is already gone for some cycles of chemotherapy, radiation, what all possible, then it is too difficult for us to manage the patients. In these conditions, we definitely go with Hemagarbha 8 grams per month, Ratnagarbha 8 grams per month, Vishagarbha 6 grams per month, Lohagarbha 4 grams per month. If it is caused already a sort of abscess-like conditions in the gut, then Sarveshwara Parpati is also added as 6 grams per month. So this is a dosage what we are trying to give for all these patients suffering from colorectal carcinomas. The textual content I'm trying to skip off considering the time limit. And this is how the patient responds. One more thing you are being booned with because you are into Ayurveda. What best we can do in these patients? The patient, if it is encirculated, when you see in the colonoscope report, the cancer is on a ring-like formation. Then it is very difficult to penetrate the basti yantra into it. Then we can go with simple matra basti with Indian rubber catheter, which is also very much possible. For all these conditions, the basmas are being given in a rectal route. So therein you have a local action and it absorbs, then you have a systemic effect in the patient as well. Absolutely, there is no problem what is happening to the patient, but they do respond very significantly. This is what we can see in the case reports. Rakta Pitta Nut, which is also a great choice, which can be seen because all these patients are suffering from lower GIT, you have lots of Rakta Pitta presentation, wherein the patient will have sort of a bloody diarrhea throughout. And the patients, there are conditions wherein they used to have 40 to 60 episodes of bloody diarrhea every day. So this severity is also been well balanced or repaired by administering these drugs related to Rakta Pitta Nut. If it is uterine cancers, like this, metastasis happening in them, Raktagna set of drugs indicated. This is the list of drug, textbook, chapter number, and shloka number. So whatever I am treating, it's a textual reference. I don't have anything to patent. It's nothing from my pocket. Whatever is there in the textbook, try to use them in the patient. This is a case report of the patient where he had colorectal carcinoma. This is how the patient responded even with Crohn's disease, Atisarahara set of drugs, prescriptions. This was how, when you see the colonoscope of the patient, it was something like you're entering into a black den, like everything is bled internally, and the patient condition was too bad. So here we start to introduce the medicines per rectal route to this particular patient, what we call it as the Basma Basti. Initially, what we need to do is we just try to give with the Pravala Garbha Pottali just to see that the things get palliated. They are hugely ulcerated, along with Panchavalkala or any drugs of these kinds. And once it sets in, then we start to use this Hemagarbha, Trailoka Chintamani, all these drugs per rectal route and try to see the response. Let us see what happens to this patient. This is how he started to heal, and this is how his gut later on, after treating with the Basma Bastis. So, and based on this particular event, we can give a miraculous response. And this opinion is again directly copied from the textbook of Sushruta Samhita. For Vranaropana, Acharya has given Shashtupakarmas. We are not using even 5 or 10 out of it. So we can use the same technique for other systems of the subject, like the Rasa medicines, and try to give it in your patients, wherein the patient will respond tremendously. All these patients are having Ayu Rasa. By the time you diagnose it, he feels himself that he is right in front of the graveyard. So Ayusha set of drugs, again indicated from the textbook of Rasashastra. So try to give them to increase the Ayu of the patient. Asadhya Roga Nashtakara, the patient is in a state of Asadhya state. Then try to give him with Abraka and Makshika. Dhatu Vivardhana and Ojo Vardhaka. Mrutyugna, the patient is, you don't want your patient to die. Rasa textbook asks you to give them with Mrutyugna. Don't allow the patient to die. Then you need to give them with Mrutyugna set of drugs. Pushti Vardhaka and Pushtikara energize the patient so that he will not land up into the illness and again and again. This part of the treatment is not done. Once we find the patient is negative for malignancy, most of the times because of the financial burden and the patient's panicness of attending to the clinics, they withdraw the treatments. But here what happens is the patient will again land up into the recurrence of the disease, which should not happen. So to avoid that particular phenomena, we have to plan up to go with the Pushti Vardhana, Pushtikara and Rasayana Chikitsa and strengthen that particular tissue so that the patient might not land up into this particular disease again and again. Sarva Vyadihara, he comes to you with a clinical presentation of syndromes. He is having huge metastasis, he is having some clinical features or scan reports saying he has metastasis in the lungs, she is having in the breast, it's there in the uterus, it's in the bone, it's in the brain, it's in the abdomen, lymph nodes, etc. It is spread all over the body, multiple systems are being involved. Sarva Vyadihara, set of drugs, as explained in the textbook. Ayurveda believes in Papa Karma, making the patient to land up into the disease. Rasashastra gives an answer to it. Manikya has been indicated to these people where you expect, like, because of the Papa Karma, the patient is landed up into the disease protocols. Sadguna Vardhana, Vajra is being given to the patient. And the most important part is the psychology of the patient. Counsel the patient in a proper way. In case if you are unable to counsel, that Bishak Vashya, when you have the patient right in front of you, try to gain the confidence of the patient. That's at most important. You don't become nervous in front of patient. You can be very clear enough to speak about what are the positive thoughts to be given, give it to the patient. What are the negative thoughts, give it to the patient party. Like, we'll try our best to see how we can manage the patient. Those things, you can use it to the patient party because the psychology plays an important role in treating the conditions. After all, I wish cancer would only be a zodiac sign someday. We have the most potent medicines like the Rasa medicines here, so we'll try to possibly eradicate this disease called as cancer. Let us use these divine drugs to treat the conditions. And after all, what we need in the patient is a good smile, saying, thank you, doctor, for giving me this rebirth. And once you achieve this target, this is most pleasing than the fees he gives to you. The consultation fee is absolutely nothing. Instead, when he says, thanks for giving me a rebirth, it's a great attitude. I do have some patients where they celebrate every year birthday, coming to the clinics and saying, this is my birth, I share you as a parenthood. Along with my parents, I would like to cut the cake in your clinic. So even though you are not a mother, you have given birth to the patient. This tendency is what Ayurveda can give us. And this is how we need to treat our patients. One protocol is, if the patient is your family member, if a patient is an unknown member, the treatment should not change. Then you are right in your treatments. If it is a family member, you give extra care. If it is a patient, you give only things which are feasible. No, everything is one and the same. And thank you very much for giving me this wonderful opportunity to share few of my thought processes to you. Thank you.
थैंक यू सो मच सर। एक बार जोरदार तालियां आप सभी के सर के लिए होनी चाहिए। व्हाट अ वंडरफुल सेशन इट वाज। आइए हम सभी लोग सर के फेलिसिटेशन के लिए मंच पर आमंत्रित करने वाले हैं आप सभी के रिस्पेक्टेड। आई वुड लाइक टू रिक्वेस्ट टू वैद्य पी के प्रजापति सर, प्लीज ज्वाइन अस ऑन स्टेज। एंड आई वुड लाइक टू रिक्वेस्ट अवर वीसी सर अरुण कुमार त्रिपाठी सर एंड वैद्य उदय तलहा सर, प्लीज आप स्टेज पर हमें ज्वाइन करेंगे। एंड फ्रॉम आयुर्वेदम फाउंडेशन टीम वी हैव अ डॉक्टर हर्ष बंसल जी एंड डॉक्टर ब्रजेश पटेल जी, प्लीज आप भी साथ में हमें ज्वाइन करें। लेट्स हैव सम ब्यूटीफुल फेस्टेशन ऑफ वैद्य गोपी कृष्णा सर। बड़े आदमी मत बनिए, तालियां आप सभी लोग बजाते रहिए। Thank you so much. From IIAR, Bellary, Karnataka, we were enjoying the beautiful presentation, beautiful session of Dr. M Gopi Krishna. Thank you so much, sir, for your love, for your kind words. और इस समय हमारे प्रोफेसर पी के प्रजापति सर एक शॉल पहनाकर धन्यवाद, स्वागत, अभिनंदन और अपने ब्लेसिंग्स, अपना आशीर्वाद देते हुए गोपी कृष्णा सर को। आयुर्वेद केशरी के अवार्ड के साथ इस समय नवाजे जा रहे हैं सर। और हमारे मर्यादा पुरुषोत्तम प्रभु श्री राम का ये प्यारा सचित्र राम दरबार देकर हम सब धन्यवाद करते हैं। मैं पीके सर से भी निवेदन करूंगा एंड आई वुड लाइक